All right. Well, the waiting room is slowed down, so should we get started and
Yeah,
we'll come a little later?
yeah, let's get started. This workshop is Medicare for All and a Just Transition for Workers. My name is Catherine Isaac. I'm the executive director of the Debs Jones Douglas Institute. We work with the Labor Institute, Chris Rabb, to do trainings with mostly with union workers about Medicare for All. We also host a podcast called Class Matters. And so with that, I'm going to turn it over to Chris.
Good morning, everybody. Sorry, good afternoon. I keep forgetting where I am. Um, if you didn't get the workbook already, it's in the chat. We're going to spend most of the time today in small groups with you all talking to each other and you figuring out the answers to these difficult questions. Just a little bit about how the small groups will work. When you go into your small groups, the first thing you should do is look at the top of your screen to see what group number you're in, because then when you come back, we'll be able to call on you. And the second thing you should do is pick a spokesperson, and we'll rotate that around. So go ahead and volunteer, and then someone else will do it the next time. Again, since we're going to be in those small groups, it's really nice to have your cameras on when you're talking to each other. So if you can do that, that would be great. And we may pop into those small groups occasionally just to see how you're doing in the conversation. So you can just ignore us and keep talking. We'll just eavesdrop for a couple minutes and see if you need more time. And we'll give you a 2-minute warning when we do decide to wrap up the small groups. So that's the basics on the mechanics. And I'll send it back to Catherine and we'll get started.
Hey, Chris, is the captioning on today?
Oh, yes. Thank you for reminding me. If you need captioning on the bottom of your screen, there's a button that says show subtitles, and that'll show you live captioning as we're talking, in case you miss anything.
Great, thanks. All right, let's get started. If you could turn to page 1 in your workbook. And again, the workbook is in the chat. So if you need to open it from there, it's there. Introduction. It's estimated that 1.8 million health insurance related workers might lose their jobs under Medicare for All. This will affect not only individual workers, but also the economic health of their communities. Job loss could also be used as an argument against Medicare for All. Today, we'll look at the jobs that would be eliminated under Medicare for All in the health insurance industry and in health provider administration, and consider what a fair and equitable transition for those workers would look like, and whether it's the labor and Medicare for All movement's responsibility to fight for it. If you now turn to page 3, where you get started with the activity, how would improved Medicare for All affect workers? So task 1 is, should we fight for dislocated workers? Workers laid off because of a transition to Medicare for All would qualify for standard state unemployment insurance. Should the labor movement and the Medicare for All movement call for benefits that go further? In the next task, we're going to discuss what those specific benefits might be. Here are 2 real-life perspectives on the question. The standard 3 to 6 months of state unemployment benefits isn't enough. We should provide a just transition for workers displaced by Medicare for All. And people lose their jobs all the time. No one helped me when my company shut down my plant and moved my job overseas. Why should these workers get something no one else does? So in your small groups, please review the fact sheets on pages 4 through 7 and answer the question below. Remember to choose one member of your group to take notes and report back to the larger group. So the question is, should the Medicare for All and labor movements fight for some type of enhanced just transition benefits for workers dislocated by Medicare for All? Why or why not? Excuse me. Does anybody have any questions before we send you to your groups?
All right, here we go.
Okay, welcome back, everybody. I hope you all had great discussions. We are now going to answer the question, should the Medicare for All and labor movements fight for some type of enhanced just transition benefits for workers dislocated by Medicare for All? why or why not. So I'm going to start with room 1. Did you guys pick a person to report back? And I want you to answer the why or why not, and then give me one reason that you said that. So that's the room with Dwight, Paul, Robert, and Sanjeev. Who's your spokesperson?
I only gave you 2 Simons, people.
We never had a spokesperson. This is Robert. But what we pointed out, yes, we do agree with that. People should be supplemented. We referred to 676, where people would be able to be retrained for at least 2 years and get up to, like, I think it's 150,000. So instead of rewriting it, just go back and look at that, put that in the bill, and we feel I think everyone felt comfortable with that. There was a couple ins and outs and minimum wage and all that, but maybe 100,000 isn't enough. But at least we came to some agreement that would be a good basis to start with.
Okay.
Yeah, there was some disagreement about the amount of money that's necessary, and it would have to be, we'd have to sort of update it, right? 676 is from 20 years ago, so that 100,000 or 150,000 might not be enough. You really have to sort of, and it also varies. The cost of living varies a lot around the country, so you have to look at that issue.
Okay, thank you. We're going to talk about what a plan might look like in the next activity. And so I'm going to do one person from each group to give me one reason. And then if we have time, we'll get some other input. So room 2, that is Bob, Diane, Judith, Larry, Martha, and Walter. Who is your reporter?
It's me. They tagged me right at the last second.
Great, Martha.
It's really practical, because if you don't include it, you create a huge opposition. And there is, and part of that is there's a huge amount of wasted dollars in healthcare going to dealing with the incredibly complex system. And the industry likes it because those people spend their time getting them paid.
So without it, you create opposition. Thank you. And then let's go to room 3. And that is, the rest of you. Anna, Gary, Gay, Lou, Mark, P, and Raymond. Who's your reporter? Anna? Great. You need to, yeah.
Well, I think, agreed that we should have some transition in place. The healthcare bill of 20 years ago or whenever was referenced in terms of embedding transition dollars in that process. We talked about a lot of things, the fact that the labor market has to, we have to work with labor unions, but that we have to identify jobs that are available. When you transition out of one industry into another, it's not necessarily just an easy move for some people. We didn't spend a lot of time focusing on the actual sheets that were provided in the handbook, but we did talk about the fact of where those jobs are. I mean, if factories or transition or training, where does it take place? Who will identify the jobs for the transition, et cetera? I think we concluded that Medicare for All and labor need to work together in that process to some degree. And that we have to get out in front of it, because once it happens, it's a huge displacement for millions of people in this case, if we're not ahead of it.
Great, thank you. So that's all 3 of the groups. Does anyone from any group have something that they want to add to that?
On why or why not we should do it, not what we should do, because we're going to do that next.
Right, on why or why not. Yeah, why it would be important.
Well, yeah, I just wanted to add that one of the things that came up in our group was, who's going to do what is very important to establish in the bill. Who's going to judge, past experience, aptability, whatnot, and who's going to be in charge of placing or offering people places of work.
So who administers the Just Transition
Yeah.
Fund? You're saying?
Yeah, thank you.
Yeah, thank you. Okay, then I think we are ready to move on to our second task. Chris?
Everybody turn to page 8, please. Page 8, task 2, what is a just transition? Fossil fuel workers are facing displacement due to climate change policies. Those workers and their unions are calling for just transition policies, which may provide some ideas for a just transition under Medicare for All. We can also see examples in the railroad industry and past government programs. In your small groups, please review the proposed just transition policies on pages 9 to 12, and then write your own policy that you think our movements should call for as it fights for Medicare for All. Feel free to add new ideas. Please choose a new reporter or spokesperson for your group. And note that though improved Medicare for All will require some new Medicare jobs, it will require nowhere near the $1.8 million jobs that would be eliminated. So we've listed categories down there for your just transition policy. Feel free to use those. Feel free to create other categories, not have something under one of the categories. That's just if it's useful for you. What's the first thing you're all going to do when you go into your groups? Look at the top screen, see what your number is. What's the second thing?
Reappoint Martha as our spokesperson.
Choose a different spokesperson. Nice try, Diane, but a different spokesperson. All right, any questions about what you're doing? Okay, I am going to mix you up a little bit so you get to talk to some different people, and I will send you to your groups. Welcome back again. Room 1, who is your spokesperson? That's Bill Gage. Oh, great. Okay, so what did you all come up with under wage replacement?
So we thought that wage subsidization would be better in the sense that you get a new job, and if you're making less than you were, you get a subsidy to make up for, to bring it up to what you were making. So that was sort of the first thing. And the second thing was to make that time limited. So that doesn't go on forever. Maybe it goes on for a year or 2 years or something, but it's time limited. Put and details right now in the Medicare for All bill, there's already a section on transition. So, adding, number one, adding explicit stuff to that would be good. Although the explicit stuff might come after the bill, it's might be told they have to come up with it. But number two, people don't know what's in that bill. That bill has a lot of great stuff in it, and we're not getting the word out about what's already in there. So we got to make sure we're not trying to solve problems that have already been addressed in that bill.
Yeah. Okay.
And
great.
we got to get the word out to the world about what's in there.
Right. Okay. Thank you. Let's go, and we'll come back around. Or we're going to go through all the topics. We'll come back around if groups have more to say about them. But let's go on to group 2 and what you said about education. Who's your spokesperson for group 2? It's Greg, Hank, Lou, Martha, and Sanjeev.
Greg's got us.
Greg's
He's on mute though.
There you go. Greg, unmute.
There we go.
On education, we want to analyze, first of all, the insurance, the types of jobs that are in, that insurance company workers have, and use that as maybe as a basis for figuring out what kind of education they need, doing maybe skills assessments also, counseling would be part of it, and also encourage people. There's going to be a demand for healthcare workers, so encourage people to go into healthcare and maybe subsidize their education going into healthcare. Of course, that would be another thing, and also use this as an opportunity to address the shortcomings of the system, right? In terms of the gaps that are currently, that currently exist. try to get workers, encourage people to work, go to work in those areas.
Right.
So also it was mentioned looking at other countries, how they address this in terms of job training and job retraining. Like somebody mentioned Germany. So that's another thing that we could look at. But all those things together would be also, of course, it would be paid for by the government, as part of the whole transition.
Okay, great, thanks. Room 3, what did you all say about, since that we kind of got some both education and job training on that. So room 3, what did you say about retirement?
Well, we didn't really talk about retirement. We talked about income security being critical on a transitional basis, but we didn't go into depth on the retirement issue. So,
okay, well, how about what did you talk about in terms of income security? Did you have specific
just that we need to ensure that on a transitional basis, there is income security for individuals losing their employment, and talked about the fact that the pandemic really changed our viewpoint on how we subsidize people's income. That, it opened our eyes to the fact that that's a viable way of handling job loss through wage subsidy. We had a lot of people losing their jobs, but didn't get thrown into poverty because the government picked up as much. People were making as much, or even in some cases more than they were making when they were working. And obviously that policy worked. And so I think we can use that as a springboard for how we handle income security for folks who may lose their jobs as a result of the transitional nature of universal health care.
Great point. Group 4, what did you all say about retirement? It's our last group.
Hi, this is Raymond, Group 4. We didn't speak a lot to retirement. A little bit in the current healthcare situation. The example how Blue Cross and Blue Shield some of the healthcare companies have transitioned to a 401k, and so some of that is starting to slip away, and that in a transition there may be pretty immediate jobs available in the public administration of the healthcare system under single payer, and that some of these companies would benefit from that and should in fact even be promoting this transition for that reason. So along those lines of securing current retirement, we talked a little bit about the 80s change in the steel industry as an example, in addition to the ones that were provided there. We kind of prioritized education and job training in terms of the policy, and included in that a federal jobs guarantee of some sort, that might be a great policy option, maybe administered by the state. Those are some of the things we talked about.
Okay, sure. Great, thank you. Did any of the groups talk about job creation? Any spokespeople want to address job creation? Yeah, Randy?
So in our bill, California, SB 921 and SB 840 and 810 in California had job creation. One of the things we talked about was, because they're not going to be part of the insurance company anymore, health insurance policy, we would teach them how to work with consumers who were going to be part of the single payer healthcare system. We would enroll them into the state, and they would get a state training. They would get a straight training grant so that they could go back to school and learn about code. They already know about coding and billing, but they'll learn it in a different way. Also in our bill, we talked about for people who want to go to other jobs, we would have a mechanism of transition. between the employment they would lose as part of an insurance company. If they want to stay with the insurance company and probably sell other policies, insurance companies do that. They would be able to set up a mechanism on the state would set up a Department of Education piece, and they would be able to train on how to be part of a single payer healthcare system. And that's kind of what Washington was kind of had in their bill. And that's kind of what California had in our bill. And so for Medicare for All, what we would do is probably the same thing, just on a larger scale. National insurance companies would either, and so they would make them work, we work with the national insurance companies and the single payer healthcare system, Medicare for All, and we would set up a training mechanism and we would work together to have these folks work. Or they could go, we would set up an unemployment system. So if they wanted to find another job, didn't want to be part of health insurance anymore, want to do something else, they would have a moment of transition in between those. And that's what California was going to do on a smaller scale on both of our bills.
Great, thank you. Gay?
One thing that came up in our group was the idea that with all the people trying to do caregiving for their elderly parents and stuff, that perhaps one thing that many workers that are displaced could do is that, but be paid for it.
Mm-hmm.
We already do pay in New York. We have mechanisms for family members to get paid for caregiving. The VA has a thing for that. So maybe that's sort of a job creation. Actually, it's a big need that is sort of unmet, it's one of the kinds of jobs that they could do.
Yeah, great.
They might even want to do. Might make their lives easier.
Great. Raymond?
Yeah, our group also talked about, and I'm sure there's other examples of this, the increased care providing that's going to come with single payer. For example, the current healthcare tourism that's happening, that's the number, I don't know, but the number was over 1 million folks who currently travel abroad to get healthcare. And of course, if it's available, folks are going to start to show up for healthcare. I know I'm in that cohort.
Mm-hmm. Okay, great. Lou?
Thank you. I just wanted to mention while we're on it that it's such a great need for assessment. And don't forget, we have 1.8 million people that are the gamut of age and education. And so we need to have an early retirement option for those that were really close to going out on retirement, and to hold them, harm-free, right?
Right.
Thanks.
Yeah, great. And Greg?
Yeah, I was just thinking of all the caring jobs are not for everybody, but I'm just thinking of the understaffed areas right now that exist, the nursing homes and the home care workers that are underpaid and have terrible working conditions. And the thing is that the patients are really needy. They need a lot of work, and and the whole system is set up to really deny, make it very difficult for workers to provide good care, right? They're just encouraged, so we need to, that there needs to be, these jobs need to be better paid, maybe some more education and training to get into the work. And so there's a lot of, this kind of job will suddenly, I would think there'll be a lot of new jobs of that kind. And of course, I was also thinking of encouraging, okay, you want to subsidize people going into becoming primary docs. This isn't going to help the insurance company workers necessarily, but I'm just saying that you're going to need, because of all the underserved areas, you're going to want to subsidize education for people that want to go into healthcare that serves the currently underserved communities.
Right.
And that would be one of the things that the system should really be thinking about and doing.
Right. Okay. Thanks. You guys are really good at anticipating our next questions. Before we wrap up this task, anything else on any of the other categories that seems important that we haven't hit on? I mean, you've hit on a lot of great ideas. Okay.
It goes without saying that under retirement, everyone's health insurance is going to be covered in the future.
Right. Isn't that nice? Just don't have to worry about that piece anymore.
And under training, again, I want to emphasize this. We don't want people to lose their jobs. You know, we had a lot of people testify against our bill who were from the insurance company who said that we were going to lose our jobs because of a single payer healthcare system. We want a seamless transition for those folks who think they're going to lose their jobs. And so that we have set up a jobs department. And I think that'd be important for the Medicare for All thing too, is to set up an employment department, especially for those people who are part of the healthcare industry who may lose their job, because, you know, they got families too. Sure. And so I think that's a very important thing that we have to do.
Okay. Thanks, Randy. All right. The last question we want to talk about is on page 13. Page 13. There's no fact sheets with this one. This is just use your imaginations. So task 3 is job creation and our vision for better healthcare. Under Medicare for All, we will no longer need billing clerks and insurance adjusters. Medical personnel won't need to spend time dealing with dozens of insurance companies. But healthcare today is understaffed and many people are underserved. What do we need to make a better healthcare system? Once again, choose a new reporter for your group. So based on your experience as a provider and or consumer of healthcare, what is needed to improve our healthcare system? Y'all have already thrown out a couple ideas, but we wanted to, really try to think big and think about roles maybe that we don't have in the healthcare system right now, in addition to adding personnel where they're needed. So just dream big on this question. Any questions before we go back to our groups? All right, this will be a pretty short discussion since there's no fact sheet, so we'll check back with you in just a few minutes. All right, I know that was a short discussion, but we don't have too much time left, and we all wanted to hear what you had to say. So let's start with room 4. Give us a couple of the ideas that you all came up with.
Was that us? Was I on that one? I remember.
Yeah. No, you were room 3. 4 was
Sorry, thank you.
Bob, Cindy, Paul, Raymond, Robert.
Well, this is Cindy. We came up with more education, money to educate more doctors and healthcare workers like dietitians and even social workers and it be community based, so people don't have to travel forever to get where they're going to go, to make sure their healthcare is designed for them, and to have somebody checking on them, that they're following their food or exercise plan, and that will take a lot more people than we have now, and have it community based.
Great, thank you. Let's go to group 1. Bill, Gay, Larry, Terry, Walter. What are a couple ideas that you all came up with?
Okay, I'll speak. Well, we thought that actually one of the missing components in our healthcare system is community health services. And if we had more community health workers, community health educators, and case managers who it would be a great transition for middle manager insurance executives to be case managers and help negotiate the transitions from hospital to subacute care to more community-based care, and know all those different systems well. And also to build a more robust community health system so that we have caregivers and community health workers and community educators all working together to improve healthcare. There would be lots of job opportunities for people in the medical industrial complex who get transitioned out.
Great. Thank you very much. Room 2, and I'm going to lean on you to be quick because I don't want to keep people over time, but these are great ideas so far. Thank you for them.
We didn't pick a leader. So Sanjeev, what do you think?
So we were talking about the shortage of both community health workers and primary care, and that a lot of medical schools take Medicare dollars, but don't actually turn out enough primary care to meet the needs of the country. So to actually like help medical schools and undergrad like re-examine how they educate their providers so that we're turning out more general practitioners, family practitioners into the communities where they're needed, and giving those community health workers the education, job opportunities, training, advancement that they need to actually make public health and individuals connected to public health the center of the system.
Awesome. All right, and group 3, we're going to give you the last word, and it's going to be a quick word.
Sure. First of all, they talked about pre-existing conditions, to work with people who have pre-existing conditions. That would cause a little research. People said we should socialize medicine, start looking at all the factors about medicine and environmental and whatever. Somebody says we need to have advocates for healthcare and how they're going to do that. I talked about ADA training and certified access specialists so they could get into the door at a hospital. Somebody talked about we need to humanize healthcare. And you know what? The possibility that they could get retrained in a job that maybe they don't want to be part of the medical field anymore. Maybe they want to be an artist or they want to be something else. They would have that opportunity by getting a 4-year degree to go train and do something else that they'd be happy with. So, I think it's a very good thing. And then we talked about social medicine, thinking outside the box and see what new and inventive ideas that could come out of it. And that's what we did.
Awesome. Thank you. And thank you guys for letting me harass you and hurry you. But those were really great. Appreciate it. Catherine?
Yeah, so I'm on page 14 with the takeaways for this workshop. Improved Medicare for All might displace 1.8 million workers who work for private insurance companies or who do insurance-related work for healthcare providers. We have many current and historical examples of ways to protect workers going through a major transition. It's up to the labor and Medicare for All movements to make sure those workers are protected by defining a just transition and fighting for it. And I just want to thank you all for joining us today and joining this fight to make a good just transition possible. So thank you all.
Thanks, everybody.
You're welcome.
You're welcome.